It's 10:03 and we've got quite a packed agenda, so I'll hand over to Sam Gluckstein, who is the head of the UK MPM.
Thanks, Freya, and good morning, everybody. It's a real delight to see so many people here today. I'll be back to speak with you in a moment, but my first order of business this morning is to introduce our leader, our chair, Sherry Ralph, who is chair of the UK National Preventive Mechanism and Chief Executive Officer of the Independent Custody Visiting Association. So I'd like to invite Sherry to make some opening remarks. Sherry.
Thank you, Sam. Good morning, everyone. Along with Danny in the chat, I too have a cold, so please excuse the slightly sniffly nature of my opening remarks. A massively warm welcome to everyone on this, which is a landmark occasion. It's the first ever National Detention Monitoring and Inspection Conference. With all of you here this morning is really genuinely wonderful to have you all connected in this online space. I want to begin by thanking you for two things. One, for making yourselves available this morning. There's a huge number of you here, and many of you will be giving up your own time or working with competing demands in order to come and speak to us and hear us this morning. And the second thing is for the work that you do, and we'll focus a little more on that as we go along. As monitors and inspectors, you represent an extraordinary breadth and depth of monitoring and inspection across the four nations. All of you contribute toward the OPCAT mandate and the shared goal of preventing ill treatment in places of detention, and your impact cannot be underestimated. The scope of the monitoring work across the UK is vast. We oversee a wide variety of detention settings: prisons, secure children's homes, police custody, mental health establishments, immigration detention, and more. This means that there are hundreds and hundreds of monitors and inspections taking place to help reach that OPCAT mandate. The scale of the UK MPM, and Sam will talk a bit more about this shortly, is incomparable, really, across the world. And the commitment required to scrutinise these places, often hidden places, really is substantial. Your work matters on both a macro and a micro level, in that your interactions with detainees on the days that you visit or you're inspecting can have a real impact on individuals, to make them feel heard, to make them feel seen, and to ensure that they know someone's watching. And that's really, really important. On a macro level, it helps hold states to account and to deliver the OPCAT mandate. So I think it would be remiss of me not to mention that, of course, we have some very challenging times across detention types across the UK. I don't think there's a single detention type that doesn't have its issues. And those include things like funding shortfalls, which lead to poor material conditions, staffing shortages. We see headlines consistently around overcrowding, and low and inexperienced staffing, leading to some very poor outcomes for detainees in the state's care. I think it's an incredibly challenging time to be working in criminal justice, and I think sometimes that can feel a little bit like you're banging your head against the door, but keep banging your heads, keep speaking up for those who can't speak up for themselves on a sort of national scale, because it does make an impact, and it is important individually and severally. There are positives to be celebrated, however, and we do consistently at the centre see pockets of good practice. We see patience and kindness and individualised treatment from staff, often in challenging conditions. And it's part of your role, as well as to raise those concerns, is to raise those areas of good practice, which is fantastic. Much of this work is captured in the MPM database, and I think it would be remiss of me to not mention the extraordinary achievement that database is. My thanks go to the MPM team, particularly for their hard work on this. And it really is, again, I've used the word landmark once. I'm going to use it again unapologetically. It's a landmark piece of work for the United Kingdom to pull together those recommendations and areas of good practice, and for policymakers, stakeholders, and monitors alike to be able to have this incredibly rich resource to draw on in order to form and triangulate opinions on spaces of detention. There are other pockets of good practice that are captured across detention settings and nations. We've seen initiatives to be celebrated on specialist interventions for young people in police custody. We've seen secure children's homes being sort of graded against a new framework, and considerably more. So I think overall there is a backdrop of challenging conditions, without a doubt, and some very, very poor outcomes. The recent IMB report on immigration, detention and use of force in particular was a very distressing read, and it would be remiss of me not to draw attention to it. While saying that, let's also celebrate those positive interventions. And I think during the course of this morning, and Sam will take us through the agenda in a little more detail, you'll see that we've got an excellent representation from both the monitoring side of things and people who run those establishments to give us that holistic view of detention spaces and what's happening there. I also need to say thank you to Sam. Sam is, as you know, leaving us to go to Ireland and then take up the position of the Deputy Chief Inspector of Prisons for Scotland. Sam, your leadership and commitment have been invaluable. You've helped shape and steady the organisation, build collaborative bridges both domestically and internationally, and led the MPM to a place where it is internationally recognised and has produced some fantastic things. So my thanks go to you for your dedication, for your personality and your wit, which have kept me on my toes over the past year. And of course, I wish you all the absolute best in your new challenges. With that, I also welcome Martin Kettle, who is taking over as the interim head of the MPM. And I have absolutely no doubt that Martin will do a stellar job in filling Sam's shoes over the next sort of 6 months or so. And I look forward very much to working with Martin and, of course, the fantastic team. And lastly, my thanks go to the MPM team and to those from the IMB and the Lay Observer Secretariat for helping organise this enormous event. There's nearly 300 of you here. This is fantastic. So thank you to everyone for helping put this together and for managing what I know is going to be a really interesting and informative event. It's been my absolute delight to be your chair for the last year, and I look forward to continuing in the role. Thank you so much.
It's a real pleasure to see so many people on this call this morning. And I thought I might just start by saying a little about why we have convened this National Detention Monitoring and Inspection Conference. And that is to say, the UK MPM is the largest national preventive mechanism in the world. It is 21 statutory bodies, and it is 3,500 people that carry out the OPCAT mandate. Now, what is that OPCAT mandate? It is proactively preventing torture and ill treatment in places of deprivation of liberty. Our breadth is enormous. We enter all places of deprivation of liberty across the United Kingdom, Scotland, England, Northern Ireland, and Wales. And we do so through in-depth inspections and broad monitoring in a number of settings. We're made up of inspectorates that go into these settings, and also monitors, people from the community that go in and speak to detainees and check on welfare. This kind of collaborative model drives standards and improvements, and it is, as I mentioned, one of the largest in the world. At the UK MPM, we meet annually with the chief executives, the chief inspectors, and the national chairs of all 21 of those bodies. We rotate around the United Kingdom, so we've recently been in Belfast, in Cardiff, in Edinburgh, and later next year we'll be in Manchester. And we meet with the 21 heads of those organisations to agree shared priorities, to agree standards, to collaborate, to share best practice. But it struck us that we don't meet with all 3,500 people on the ground doing the work finding the evidence that inform the reporting and hold decision makers to account. And so we wanted, with this first ever National Detention Monitoring and Inspection Conference, to extend the invitation for all 3,500 monitors, inspectors, support staff, comms individuals, everyone involved in implementing the OPCAT mandate across the UK to come together to share best practice, to share concerns, frustrations, to ask each other questions, to learn from each other. Now, the format of today's event will take the form of 3 panels, which we hope will be informative and will give an opportunity to share. With this many people on a call, the opportunity to do breakout rooms and have a discussion is limited, but we hope you'll take advantage of the opportunity for Q&A and to really discuss with speakers and each other the areas of importance. I'll ask Sara to bring on screen the agenda and talk you through today. So you've just had a welcome from UK MPM Sherry Ralph, and this is my welcome. We'll then are really delighted to hear from the chair of the United Nations Subcommittee on the Prevention of Torture, Maria Luisa Romero. Now, Maria Luisa chairs the committee that is responsible for all MPMs globally. That is every country that has ratified the optional protocol and has an equivalent of all of our roles across the world. Maria Luisa has been with the subcommittee for a number of years and took up chair recently, and she's led the committee through a really impactful but challenging time. The UNSPT visits countries, makes recommendations, and also kind of oversees all of the OPCAT and MPM work. They act as a source of advice and inspiration, and so I'm really looking forward to hearing from Maria Luisa. As you may know, the SPT visited the United Kingdom in 2019 and visited a number of places of detention, and their report has really helped us in our drive to increase standards. We're then going to look at how UK MPM mandate holders fit into national and global MPM efforts. And we're delighted to hear from Ben, Sara and Jansy, and you'll hear more about them later on this morning. But that panel is going to look at how your findings come together and inform that global picture, and the work of some of your colleagues at the Inspector of Prisons in Scotland and Ofsted, because one of the great benefits of having this multi-body MPM is that we all do things slightly differently, and hopefully by hearing from Sara and Jansy, we'll be able to reflect on our own practices and the work of colleagues. Next, we will have insights from UK MPM staff and volunteers, and I'm delighted that we have a cross-section of colleagues from across Scotland, Northern Ireland, Wales and England, across the volunteering and the inspectorate side of the house, and also comms and membership engagement officers to be able to tell us about their work and how they drive impact. And then I'm very pleased that we'll also hear from duty bearers' experiences of scrutiny. So I'm delighted that we have the Director of Nursing at Broadmoor Hospital, the secure mental health facility. We have Chief Inspector Andy Poole, who oversees police custody, and Paul Thomas, who runs a secure children's home in England. We were hoped to be joined by Karen Norrie, but unfortunately she's been called away to an emergency. And in a bit of last-minute agenda shuffling, my team are working in the background to see if we can't procure another governor in charge to talk about their experience of scrutiny, and we'll keep you posted if we're able to parachute one in. Colleagues, I'll close simply by saying, as Sherry did mention, this wasn't planned at the time of arranging this conference, this is my last day as head of the UK MPM. I will, on Monday, go to Ireland, where I'll take over as expert senior advisor on OPCAT implementation. The Republic of Ireland is the last country in Europe to establish a national preventive mechanism, and I'll spend some time over the winter and early spring supporting bringing that to fruition. And then, as Sherry mentioned, I'll take up post in Scotland as deputy to Sarah Snell, who is His Majesty's Chief Inspector of Prisons in Scotland. And it really is an honour for me to take on that post. But my time at the UK MPM has been very important to me. I've loved this job and every minute of it. I've loved working with those of you who I've met and being connected to this huge and powerful organisation. and I wish you all the best in your future endeavours in pursuing driving standards, holding duty bearers to account, shining a light on good practice as well as bad, and maintaining standards and decency for those who are the most vulnerable in society and are lacking in a voice for which you are their voice. I will still be part of the UK NPM as Deputy Chief Inspector, and I'm delighted to be part of this community, which I think is powerful and strong. I hope you find our conference this morning useful and helpful. I hope if you do, we will have another, and that will be for the future NPM team to decide. But if they do, I will be in the audience asking all the difficult questions, and I encourage you to do that this morning. So with that, I will pause my remarks and introduce Maria-Luisa Romero, who I have just mentioned is the chair of the UN Subcommittee on the Prevention of Torture. She joins us with a pre-recorded statement, but I'm also very pleased to say Chris Nissan, who is the member of the UNSPT and country rapporteur for the United Kingdom, it joins us live. And so Chris will be able to participate in the Q&A later on in the morning after panel 1. But if you'll join me in welcoming Maria-Luisa, who, if she had joined us live, I think she would be joining us at something like 3 in the morning. So we've allowed a pre-record on this occasion, and I hope you'll find her remarks interesting and informative and perhaps inspiring. So
good morning, and thank you so much for inviting me to this important gathering. Even from afar, I can assure you that I feel close to this community, because the work you do lies at the heart of what the OPCAT system was built for. Today is a historic moment for the UK NPM. For the first time, as I understand it, all OPCAT mandate holders across the United Kingdom are coming together. Inspectors, monitors, researchers, analysts, support teams. Everyone who, across jurisdiction, makes prevention possible. Bringing all these perspectives into the same space is not just symbolic. It is profoundly meaningful and impactful for the global system of prevention you belong to. The UK NPM is unique, complex, and its members bring a wealth of experience to the national and global prevention systems. With over 3,500 individuals carrying out tens of thousands of visits each year, you have built an extraordinary body of knowledge. Thousands of visits, thousands of recommendations, and a depth of understanding across settings that is widely respected. As highlighted in the foreword of your last annual report by the NPM chair, Cherry Ralph, preventive-based scrutiny is focused not just on what is found in visits, but on what is not found. And this is what makes prevention so powerful. By detecting risks early, addressing gaps before harm occurs, and ensuring oversight, even where violations are not yet visible, your work fundamentally improves the experiences of people in detention and helps prevent suffering before it happens. Let me step back and remind ourselves why torture prevention matters so deeply. Torture is one of the most devastating violations of human dignity, and it almost always happens in silence, behind closed doors, in places most people never see. Prevention means acting before that silence is created, before that darkness is created, opening doors, asking the right questions, listening to people who are rarely heard, identifying risks before they become harm. OPCAT was a turning point in 2002. It created the first coherent global system dedicated to prevention and made NPMs its backbone. The SPT cannot be everywhere. We visit only a handful of countries each year, but you, the NPMs, open hundreds of doors. You influence legislation, shape policy, and humanize systems that too often forget the people inside them. We're all aware of the reality facing the United Nations, a profound crisis, not only financial, but also political. Impossible choices are being forced to make. And for the SPT, the impact has been very real. This year, we have only conducted half of our planned visits, 4 in total. When the SPT cannot visit, something essential is lost. Private conversations with people in detention, early detection of risks, and the chance to bring international attention and support to national actors. But it is precisely in such times that NPMs become even more vital. We saw this during the pandemic. When the SPT could not enter places of detention, NPMs around the world stepped up, keeping prevention alive. Thanks to a timely question from the UK NPM, the SPT issued critical guidance on the treatment of persons held in compulsory quarantine. Guidance that proved relevant not just in the UK, but for the NPMs globally. This is a concrete example of how your work strengthens both national and international prevention efforts. Challenges remain, of course. Structural limitations, unstable staffing levels, support for those with mental ill health, increasing numbers of people deprived of liberty, and of course, something the SPT has repeatedly emphasized, the lack of a statutory basis for the NPM as a whole. Yet, despite the challenges, NPMs work to ensure that scrutiny has real impact. A multi-body NPM like the UK's brings enormous strength, though also complexity. Your breadth allows you to analyze systemic issues across detention studies and jurisdictions, from prisons and youth offender institutions to immigration detention and mental health facilities. And in this context, I really hope that the SPT's first general comment has been able to aid your efforts to visit all places of deprivation of liberty. The collaborative working of the NPM, the connections between organizations, and your collective voice can make prevention stronger. This conference is therefore much more than an internal exchange. It is a moment to take stock on what you have achieved, to recognize the ongoing challenges that require your sustained attention, to learn from each other, and also to reflect on what the UK contributes to the global prevention system. The UK NPM constantly makes meaningful contributions internationally. This year, I myself benefited from the support of the UK NPM to participate in a fascinating workshop in Peru that brought together NPMs from across the Americas to discuss environmental conditions in places of deprivation of liberty. Had it been not for this invitation, the SPT would not have been able to be present, and we are thankful. Let me close with a reflection. Every time I visit a place of detention, I am reminded, as I hope you are, that persons deprived of liberty are among the most invisible human beings in our societies. They rely on others to be seen, to be listened to, and to ensure their dignity is respected. And you are those people. You open doors, ask difficult questions, insist on transparency, and stay committed, even when systems are under strain. Prevention may not make headlines, but it changes lives quietly and profoundly. That is why days like today matter so much. By gathering, reflecting, and learning from each other, you strengthen the very heart of the OPCAT system. I wish you an inspiring and productive conference, and I thank you sincerely for everything you do, both for the UK and for the global efforts to prevent torture and ill treatment. Thank you very much.
As it's a recording, but I'm sure you'll agree that was a really motivating opening speech from her. So the first panel, my name is Rachel. I am Freya's colleague at the IMB and Lay Observer staff team. The first panel that we're going to hear from are going to be talking on how the UK NPM mandate holders fit into a national and global NPM effort. Our first speaker today is Ben Buckland. Before I hand over to you, Ben, I'm just going to say a little bit about you. Ben is a senior advisor and association for the prevention of torture, a Geneva-based non-government organisation that helped draft the optional protocol for the Convention Against Torture and works to support the NPMs around the world. So without further ado, over to you, Ben. Thank you.
Thank you so much. It's a real honor and a privilege to be able to speak to you all. And I'll try and bring in a little bit of that kind of global that global experience that you talked about by talking about the OPCAT system and about how MPMs in other places have managed to do well. As Louisa, she spoke about the OPCAT and the system and the international context, but I imagine that for many of you in the UK MPM, you work away and do extraordinary work monitoring and inspecting and reporting and cooperating, possibly for many of you without spending very much time thinking about the fact that you're part of an MPM and that MPM is part of a global torture prevention system called the OPCAT. And of course, this makes sense because in many ways, the UK MPM is unlike all others. It's certainly one of the oldest, and as Sam said, it's by far the biggest. And it also brings together many organizations that existed far earlier than they ever had this MPM label added to them. And so many of you have cultures and practices and approaches and ways of doing things that massively predate your being part of an MPM or an OPCAT system. So thinking about today and what I could maybe say that would be useful to you, taking into account that vast experience that so many of you have, I was thinking I could just reflect a little bit on what other MPMs in other contexts have done when they've been successful and when they've done good work, in the hope that some of those examples could maybe be a little bit inspiring to you in your work. And I think the first thing, and this has been alluded to already, is that I think MPMs elsewhere have done their best work when they come and bring an objective and outside gaze to a place and ask the question, why do you do things like that? And my favorite example of that is from a few years ago now, where in Norway, the MPM visited a mental health establishment and realized that the day shift and the night shift were using force in completely different ways because they weren't meeting with each other and not talking to each other. And it took that outside gaze to come and say, hang on, why are you doing things in that way? And of course, MPMs around the world have done extraordinary work when they're focused, as many do, on people in the greatest situations of vulnerability. And a great example of that recently, of course, is the UK's contribution to a global report that we brought together on women deprived of liberty. But there are so many examples of that focus that MPMs everywhere bring to those most at risk. And of course, while the focus of MPMs is, I think, on human dignity broadly, I think we shouldn't also forget that many MPMs have done extraordinary work in uncovering and preventing the most serious violations of human rights. And in the Philippines, for example, where the interim MPM, the Human Rights Commission, entered a Manila police station for the first time, they found a whole hidden room behind a bookcase where men and women were being tortured. And even in Norway, which we often kind of hold up as this example of a system that works really well, the MPM found that the immigration police there were using this kind of nightmarish sensory deprivation mask on detainees in a way that was completely unacceptable and illegal. MPMs, I think, also have been really successful when they've brought a focus not just to specific places, but to processes and how those places connect together. And in Australia, where I'm from, becoming part of the OPCAT system and creating an MPM was the first time that in some jurisdictions, police custody had ever been independently monitored, but also the first time that people thought about what's happening in prison. It begins at the moment of arrest. It begins in police stations, and those processes and those things are linked, and thinking about it as a system rather than specific places was something that joining the OPCAT really allowed those institutions which predated it to begin to do. In New Zealand as well, before the MPM was established, there was no independent monitoring. And even afterwards, for a little while, there was no independent monitoring of health and disability institutions. But by working within that framework, and Louisa mentioned Article 4 of the OPCAT and their general comment, they were able to realize that actually there were gaps and that those gaps could be filled by the MPM. And of course, they discovered some quite serious and very troubling problems in those places, including seclusion rooms and other kind of controlling practices. And I think, lastly, the OPCAT system works well and MPMs work well when they focus on dialogue. And I think a good example of that for me is in Switzerland, where APT is based, where the Swiss MPM visited for the first time all of the youth detention settings in Switzerland, drafted their recommendations, and then brought together, and I know that many heads of institutions are here today, brought together those heads of institutions and said, this is what we think the solution is, this is what we think the recommendations are that we're going to make, but what do you think should change to make things better? And I think that back and forth and that discussion is really at the heart of what makes MPMs work well. I think beyond those specific examples, I think when MPMs do best, I think it's also when they hew closest to the preventive logic that's really at the heart of the mandate. That when they go beyond what is happening to a single person or what's happened to a single person or what's happening in a single place, and think about how that place or that person, how they might have things in common with other people in other places and where they might be facing similar risks. And that, of course, means going beyond one instance of something, one bad thing, and asking, is this happening again and again, or is this happening in other places as well? And then asking, of course, well, what might be causing that? Is it a bad policy? Is it a bad law? Is it a lack of knowledge? Or what's behind it that's causing that to happen? And then asking, too, what the people involved think about why they're doing it that way. Is it because they think it's for the best, or because there's no other option, or because they just haven't thought about and never been questioned about it before? And I think when MPMs do their best work, I think it's because they're digging deep enough to understand the full extent of a problem across places, and then doing the work to answer the question of why that's happening, and then being strategic about how to solve it. And sometimes how to solve it is simple, and the Norway example I gave, just asking the question was enough to solve it. And sometimes the answer to that is very, very difficult. And in New Zealand, for example, after many years of recommendations by the Ombudsman not being implemented by the Department of Corrections, the MPM did a whole report on the internal culture within that department to really understand and try and unblock that change that wasn't happening. And sometimes creating change also means doing less and being more strategic. And in the Netherlands, for example, the NPM there has really focused on a very small number of harmful practices in a small number of institutions to really try and be as strategic as possible and drive change. And then lastly, and I'll close in a moment, and apologies, it seems like my internet connection is not particularly stable. Hopefully you can hear me even if you can't see me. Seeing me, it's not always cracked up to be anyway. I think the last thing is the connectivity to the international system. And I think MPMs that are doing best work are those that are connected strongly to that system. And sometimes that's bilaterally, and I was pleased to convene a meeting several years ago now between the Scottish Human Rights Commission and the New Zealand Human Rights Commission to talk about staff retention in prisons. Someone from the CQC, an expert by experience, attended a meeting a year or so ago that we organised on mental health monitoring for European MPMs. And we've worked with Sam in many contexts with other MPMs. And I think that connection to the international system, realising that you're not alone doing this, is such a strength of the system. And I would really encourage those of you who haven't connected to other MPMs to do so, and to use us to help you do so, because I think that connection is such a strength of the system. Also connection to the SPT and to the Committee Against Torture and to UN processes, and you can do that via the MPM and also via your national human rights institutions as well. Right, so I'm coming up against my time, but I really just want to end by thanking all of you, and most particularly by thanking Sam and wishing him well on his next steps. It's been just an enormous privilege for me personally to be able to learn from you, Sam, and to cooperate with you in this role in lots and lots of places. And I know it's been enormously helpful to us at APT and also to other MPMs around the world to have you there and have your willingness to jump in often at the very last minute to help with questions and to connect with other MPMs and work with us in places around the world. So thank you enormously, and best of luck for what's next. Thank you.
Thanks ever so much, Ben. Just to say, while blurry, you were heard very clearly, so thank you. We'll no doubt come back to you at the end when we have everyone on the panel as part of the Q&A. Next, I'm going to hand over to Sara Snell, who is His Majesty Chief Inspector of Prisons in Scotland. Sara has extensive experience in the UK justice system, having previously worked as an inspector and prison governor in England, and most recently working as a prison systems advisor at the International Committee of the Red Cross. Over to you, Sara. Thank you.
Thank you very much. And just reflecting on what Ben said about Sam's role in the NPM and on that kind of wider stage, I think he's really going to miss that in Scotland, because it's not quite the same travelling to Inverness as it is to some of the places that we know he's been able to support the wider endeavour around preventing torture and ill treatment. So yeah, well done for all that you've done with the NPM, Sam. This morning, I've been asked if I would give my reflections on an inspectorate that combines monitoring and inspecting, and how we use these findings to drive standards and improve treatment and conditions for prisoners. I talked back at the conference in April about what I thought to be a unique blend in Scotland of inspection and monitoring in a single inspectorate body. The Public Services Reform, Inspection and Monitoring of Prisons Scotland Order 2015 came into force on the 31st of August 2015, and from this date, His Majesty's Chief Inspector of Prisons, or hers as it was then, in Scotland assumed overall responsibility for the monitoring of prisons, which is carried out on a day-to-day basis by independent prison monitors. As I only have 10 minutes, I will touch briefly on how important the work independent prison monitors is to the inspection process, but focus more on the things IPMs are able to pick up, raise and have resolved that inspections would come too late for or potentially not cover. IPMs report their findings against every statutory weekly visit. These are used in monthly reports and meetings with the governors of the individual prison they apply to, but are then published in half-yearly and annual reports where wider patterns and trends are pulled up as headlines. I can look every day at what IPMs are finding in any single prison in the case management system, and we ensure any risks are included in the quarterly risk review, which then informs our inspection programme. We run a focus group with IPMs of any prison we are inspecting to get their collective thoughts on the current situation. We share with them the pre-inspection survey we conduct in advance of the inspection, and they can give their views on the initial prisoner responses. This is particularly helpful where we increasingly have prisoners raising concerns with us about staff-prisoner relationships, and IPMs give us their views. We find they are invariably accurate in pinpointing where things are working better and where they are not when we inspect, still with an open mind, about what the problem might be. Inspectors quote evidence gained from IPMs as part of the writing up in inspection reports. Focusing more on the immediate value of IPMs within HMIPS in driving standards and improving treatment and conditions, I can do no better than demonstrating examples of what they have done. At HMP Grampian, the pandemic restrictions, as across so many prisons, meant many statutory rights enshrined in national legislation were not met. Our experience has been that recovery has been slow and sporadic. Grampian IPMs were the group who realised many months on that remand prisoners were not getting their daily entitlement to a visit. They consistently raised this breach until it was reinstated. You will read in our shortly to be published remand thematic report that remand prisoners at Grampian were not even aware that they had the right to a daily visit. HMIPS has written to the SPS outlining our concerns at plans to bring in a revised staff roster across the prisons in Scotland. The intention is to try to ameliorate staff deficits, which are making for inconsistencies in regime delivery, difficulties in managing multiple prisoner cohorts, and delivering critical work such as personal officer and programmes provision. As we are able to be ahead of the event in this case, unlike with the pandemic, we are asking IPMs, with the help of some guidance, to monitor the current provision so that we might compare it with the changed provision to see what really happens. This is the inestimable value of having people embedded in individual places of detention, knowing what is happening in the here and now, and willing and able to chart whether intended changes for improvement actually deliver. IPMs conduct thematic work alongside their statutory visits. For example, at Poulton, they were interested to see what prisoner consultation at the prisoner-led groups looked like. The governor there is also keen to see how things might be improved in terms of prisoner participation, engagement, and response to actions on feedback. So this ongoing work helps to understand the issue, map changes, and evaluate improvements. The governor at Shotts was as concerned about prisoner access to making complaints confidentially and having their cases properly reviewed and answered as the IPMs and HMIPS are. She instituted some ways in which she thought things could be improved, and the IPMs followed them up to see whether the prisoner experience was any different. HMIPS piloted using IPMs to conduct field research in the remand thematic review. The initial prisoner perception was gained from analysis of the remand prisoner views as expressed in the HMIPS pre-inspection prisoner survey results between 2022 and 2024. A methodology was devised and IPMs added their observation on remand halls and from interviews with prisoners. Positive engagement between IPMs and prisoners led to 101 hours of fieldwork and 89 remand prisoners being interviewed. If a measure of something's success is the enthusiasm to repeat it, IPMs gave positive feedback on having the opportunity to contribute more widely to the work of HMIPS, and we on having them to do that. Learning from that first experience for future thematic reviews, we will design smaller focused projects for IPM participation and improve our training and guidance that we provide to IPMs in advance of them carrying out that work to improve the depth of the data for us. Before I run on too long, I want also to flag the inestimable value of something the IPMs can do comprehensively, whilst it would be purely serendipitous if HMIPS were able to do it. And that is ensuring that prisoners exercise their rights as citizens when these opportunities arise. The right for remand prisoners to vote, which will be vital in May next year here in Scotland. There has recently been a consultation in the parole process here, Voices in Justice, a consultation on parole reform in Scotland. This sought views on issues raised by victims, specifically on improving transparency and communication of parole processes for victims and their families. I don't think it would be stating the case too strongly that prisoners would not have had a voice in this consultation had the IPMs not followed this assiduously in their individual prisons. As I think we all know, prison systems grind incredibly small and incredibly slow. Had this not been raised in prisons with the SPS and had third sector organisations not combined their efforts with the IPMs locally, I believe the consultation period could have been and gone with prisoners none the wiser. IPMs do their best not to get sucked into trying to resolve individual requests or complaints, hard as this can often be, but try to understand systemically what they were pointing to and doing something about this where possible, which is very much what Ben was talking about, but in an even wider context. The team at Low Moss did some investigative work around time out of cell for offence protection prisoners. They had taken a series of prisoner requests from this group and thought there might be a pattern. They found that while the regime gave equitable time out of cell to all prisoners on paper, where there were pressures, shortages, unforeseen events, the offence protection prisoners felt they were regularly the group that had to forego time out of cell, including visits, fresh air, education, showers and recreation. IPMs monitored this over a decent period, up to about 3 months, and held mini focus groups where issues around staff attitudes, stigmatising and judgmental remarks to allegations of bullying and discrimination were also aired. Our prison monitor coordinator wrote a paper on behalf of the IPMs to the then governor, who responded, acknowledging the issue and committing to investigating and exploring further. He also wrote back with a series of actions aiming to uphold entitlements of offence protection prisoners, and things improved, at least for a period of time. IPMs had not necessarily intended to look into this issue, but in taking individual requests from this group, they had been given this kind of instinct catalyst to look at something and asked if they could spend some more time exploring it. We surely are not making the most we can of this great model for improving outcomes for prisoners held in Scottish prisons. Our current ambitious standards revision will specifically look at how we can improve guidance there for IPMs, whilst absolutely enshrining their role as extraordinary, ordinary people visiting prisons rather than as inspectors. We are thinking of inviting them to the end of the inspection process so they can hear what inspectors have found and say whether this meets with their experience, which is not something we currently do. And we are also thinking about harnessing the outcomes we want to see after inspection, as well as the day-to-day issues IPMs pick up. Thank you.
Excuse me, thanks ever so much. We'll be coming back to you again, Sarah, as part of the Q&A at the end. Finally on the panel, excuse me, my camera is off, apologies all. Finally on the panel, we're going to be hearing from Jansy Kelly. Jansy is Deputy Director of Social Care and Regulatory Practice at Ofsted. Jansy oversees the quality of Ofsted's social care inspection and regulatory activity, and ensures that social care inspections are equipped with the knowledge and skills required for them to effectively deliver their roles. Over to you, Jansy. Thanks ever so much.
Thanks very much, Rachel. And apologies, I'm like other people, but perhaps losing my voice a little bit after a cold. So hopefully I'm clear to people. I'm a relative newcomer to the work, the vast work of the MPM, and really pleased to be able to be here today to talk about the work that Ofsted does. And our work primarily is supporting HMI prisons, inspections and prisons of young offenders institutions, leading joint inspections of Oak Hill Secure Training Centre, the last secure training centre in the country, and also Ofsted's registration, inspection and regulation of secure children's homes and the new 16 to 19 academy. There's also some other areas of Ofsted where we come across in our inspection and regulatory work, such as the deprivation of liberty of children as a result of the court's use of their inherent jurisdiction. We continue to be very cited on this. We're very aware. We don't have a mandate sometimes with these children, those that are placed in unregistered children's homes. Those are children that are probably slightly unseen. And something that we keep kind of flagging and challenging ourselves on. I'd like to thank the Secretariat of NPM for inviting me to speak at this first all NPM online conference, and very pleased to give some insights into our work. Ofsted's remit covers England. We register, inspect and regulate 13 secure children's homes and the new type of provision, the Secure 16 to 19 Academy. These are all inspected a minimum of twice a year under the Social Care Common Inspection Framework, and the Secure Academy is also subject to inspections under the Education Inspection Framework. We are supported in our work by the Care Quality Commission, who provide us with their expertise in assessing children's health and the quality of health services. Ofsted is the lead inspectorate for the Oak Hill Secure Training Centre. Biannual inspections of Oak Hill are carried out under a service level agreement with the Ministry of Justice and under a joint inspection framework with our partner inspectorates, HMI Prisons and the Care Quality Commission. Ofsted further Education and Skills HMI also support HMI prisons inspections of prisons and young offender institutions, providing them with our education and learning expertise. We work closely with government departments, providing our insights, advice and expertise, and assisting central government in developing policy, statutory guidance and legislation. We seek to constantly evolve our work and improve our quality. So, for example, in the last year, we've reviewed and revised the Secure Training Centre inspection framework. Prior to the review, we had an area of resettlement. What we've discovered, and resettlement is about children returning to their home community when they're released from custody, but the demographics have changed. Now, about 21% of children who enter custody serve longer sentences and actually transfer into the prison estate when they move on, so they don't resettle. Our new framework provides an equal focus on the support children receive when they transfer to new adult estate, but also when they resettle back home. We've published some key inspection findings in the past year. I'll draw attention to two very specific examples, but did want to share that our inspections generally find that children living in secure children's homes are provided with good levels of care, and their support and education is also usually of a good standard. Secure children's homes, they've embedded the trauma-informed model called Secure Stairs that involves providing more developmentally attuned and psychologically informed care. And that's centred around comprehensive co-produced assessments of children's needs. So really good sort of strides forward in the secure children's home place. In July this year, we inspected Oak Hill Secure Training Centre and found it to be inadequate. We found some very serious and worrying concerns about the care and safety of children. The inspection report's published on our website, so do go and have a look. But what we found was that safeguarding systems were in disarray, with a failure to report on serious matters to relevant professionals and bodies, placing children at risk of harm. Leadership had failed and was really quite fractured when we visited. Some children were separated inappropriately from other children from extended periods without a clear justification. There were serious and systemic failings in healthcare provision, placing children at significant risk. Some of the children were living in unsanitary conditions. Some children experienced pain during the use of physical restraint by staff, something that Ofsted absolutely does not endorse. There were a significant number of allegations about staff conduct with children, and some of those were subject to investigations, and some of those investigations remain ongoing that either include or are being led by the police. Another important finding at this inspection, which speaks to many of the issues that Sara drew our attention to in her input to this meeting, is the important role of those visiting and working in the settings where children are detained. There's a real need for those people to accept that they need to be observant to the needs and risks of children, because they are part of the important network of safeguards for these vulnerable children. And if they don't take that role seriously and they just go in and do their really narrow piece of work, they're not contributing to that full kind of safeguarding network for children. Now, one of the things that we can do as a result of concerns in our inspection is meet and issue what's called a kind of urgent notification. And following this inspection of Oak Hill, we joined together with the chief inspectors, so it's chief inspectors for Ofsted, HMI Prisons, Care Quality Commission, and they decided to invoke the urgent notification protocol. So we wrote a public letter, again published if you want to have a look, to the Secretary of State for Justice, asking them to intervene. And they responded with actions to be taken to improve children's care and safety. I'm very pleased to say that when we went back to Oak Hill in September, we did find that there'd been much work to improve provision, but we also found that a number of areas where the progress had just been too slow. That inspection is also published, and we will be monitoring closely and carrying out a further inspection before the end of March 2026. Another aspect to perhaps draw people's attention to is the new Secure 16 to 19 Academy. That's temporarily closed in September after being open for 12 months only. This speaks to some of the challenges that these settings have in setting up new provision with sufficient safeguards. And we undertook a monitoring visit alongside a specialist architect in 2025. And we found that the building design and security and safety elements were failing. At times, children were being locked in their rooms for their own safety because of weaknesses in the building design. The provider rightly took the decision in collaboration with the Ministry of Justice to temporarily close until they can complete the actions to make that setting safe for children. We engage with many people in the sector to assist in their understanding of the legislation and to share practice between inspections. We work with partner inspectorates, and we've recently initiated bringing together the inspectorates of Northern Ireland, Scotland, Wales and Ireland with ourselves. We're now meeting regularly, identifying trends and themes and good practice so that we can develop our skills and approaches to inspection and regulation. Sadly, as you heard about with our findings at Oak Hill STC, while we can always prevent poor practice with children, we always strive to call out poor practice and to promote best practice. We're doing a lot of work in the moment right across all of our work to talk about that safeguarding network that protects children, not just in the secure statement, but more widely. Because as an inspectorate, we can't, it's often too late, as Sara says, when we arrive on site. I hope you have a fantastic day today. I think that I've given you a very brief insight into our work and really look forward to working with NPM partners and the Secretariat team in the future. And I can't fail to say happy last day to Sam.
Thanks ever so much, Jansy. Really interesting insight into the work you do.
Okay,
really
we're going to move on
appreciate it.
to panel 2 now, which is insights from UK NPM staff and volunteers themselves. We are hearing first from Camilla Poulton, who is a long-standing IMB member at HMP Pentonville in London, and she is also a member of the Independent Monitoring Board, National Board. The IMB, Independent Monitoring Boards, monitor prisons across England and Wales, as well as immigration detention facilities across the UK. Over to you, Camilla.
Thank you very much, everybody. I've been a member at HMP Pentonville for 11 years, and I'm one of about 12 members of the local community who are appointed by the Secretary of State to monitor the conditions at this establishment. And I am one of about 1,100 members nationally who monitor across our sort of portfolio of places of detention. There are 3 main duties that we have: to monitor the prison, to be available to prisoners to hear their problems, and to produce an annual report for the Secretary of State. And I've been asked to reflect in approximately 8 minutes on challenges of being an IB member, some of the successes personally at a local level, and reflections. So I'll try and cover as many things I hope will be of interest as possible, and then happy to take questions later. Picking up on some of the points that my colleagues have spoken about, the environmental and infrastructure challenges, that is certainly a key one. Pentonville is a Victorian prison in North London, close to King's Cross, opened in 1842, originally for 520 prisoners, and now there are about 1,200 men, mostly in double cells, many of them Victorian cells. And the maximum number of prisoners that can be held is only very slightly more than that. So it is an overcrowded prison by any stretch of the imagination. It's also one of the busiest in the country, with about 4,500 new prisoners coming in every year. And it has one of the most challenging populations as well, high levels of gang nominals, about a quarter of the population of foreign nationals, approximately 100 young adults. So that's men aged 18 to 21 or 25, depending on your definition. About 3/4 of the population are on remand, which is massively impacted by the court delays, which are for a variety of reasons we're all familiar with. About half of the population are Black and minority ethnic, And a unique feature, which actually I only discovered yesterday, it has the highest population of Muslim prisoners in the country and in any of the London prisons at about 40%. The prison is divided into a mixture of healthcare, inpatients, segregation, neurodiverse, a large early days in custody wing, and I'll come back to that, and a sizable vulnerable prisoner population. And HMIP visited this year, and their visit has resulted in an urgent notification. So picking up on some of the comments from Jansy about Oakwood, and I know other colleagues attending will have that experience. A key quote, they said, "It will take support and investment from the prison service to turn around this troubled jail." I mean, I think that is understatement of the year. The neediness of the prisoner population that we engage with as monitors, the decrepit infrastructure, including inhumane living conditions, picking up what was described as unsanitary conditions, I think, in the children's setting. Absolutely. Cockroaches, leaking toilets, mice, broken windows, not enough bedding, holes in the wall, you name it, it's there. Not enough psychological support for the men. This idea of there being a trauma-informed approach, I mean, that would be nice. And I'm sure some colleagues either have that sort of professionally in terms of training, but there is massive need. Almost everybody you've spoken to will have had some trauma in their life, and that may well have directly contributed to their being in Pentonville. And then one thing is, as an IMB, not being able to bring the media in with us to really share what we do. I'll come back to that because it is a key part of our statutory duty to report for the Secretary of State on what we find, but there are other things that we are uniquely placed to do as independent monitors. So that sets the scene for some of the challenges. Our successes, I really liked what Sherry said about the micro and the macro value of what we do. And through our presence several days of every week of the year, we can spot and raise small issues with the managers and governors as soon as we become aware, to stop them hopefully becoming major issues. I mean, flashpoints like there not being enough underpants or there not being enough towels, things like that nobody else would be able to sort of pick up and raise. It's micro, but it's also macro. It's about decency. We work hard as a board, and always have done, to have good working relationships with senior management. And if any one of us is particularly concerned about an issue when we're physically in the prison, we just go and speak directly to that person. We are confident in our relationships, and we're confident in our independent monitoring observations to do just that. We also produce an annual report for the Minister. You can read all the IMB annual reports on our website, and there's a formal response to that. But to the extent that there are issues which can't be resolved locally, or which are causing direct harm to prisoners or frustration beyond what the board can tolerate, then we are also empowered to write directly to the Minister and the Secretary of State. And as a board, we did this most recently in April last year. We escalated concerns about the state of the kitchen, which was infested with rats. We had done everything we were supposed to do. We regularly reported over about 9 to 12 months, every week, week in, week out, our observations to management. We reported what the prisoners working in the kitchen had said. We reported on the civilian staff's observations. We reported our own observations, but nothing happened. And in April, we just lost patience with the situation, and we told the Deputy Governor what we were going to do. The next day, we wrote to the prison group director, who also had been the former prisoner, the former governor at Pentonville, and the area executive director. The next day, we contacted the then Minister for Prisons and the Chief Inspector of Prisons. And then on Monday morning, my colleague and co-chair, Alice Gotto, telephoned Environmental Health and reported the prison, and it was closed down the next day for about 2.5 months, with the release of uncapped amounts of money and coordinated contractors for the essential works. Okay, that was good. We were pleased about that, but it was so frustrating that it took extreme action by us and basically professionally embarrassing the prison, which did dent our good relations for a little while, to get any change. And I'm sure many of my colleagues on this call will know how glacial change is. I mean, that was a success. We were pleased that finally there was uncapped monies and there was a focus on decency, and there was a realization that the rats and the other pests in the prison could not be ignored. And just recently there's been a programme of cockroach treatment for the first time in my time, across all wings, across communal areas. And you know, that is something that we are pleased to have been a small part of. The idea of taking these issues outside of the jail, as I said, is something that we are empowered to do, and I'm proud that on my board we have never shied away from doing that. We have written in the past to ministers about chronic overcrowding, poor facilities management service delivered by Carillion, and now it's with GFSL, the state of the windows and the security grills. We are lucky to have a stable and committed board, but that takes a lot of energy from board leaders and resilience as a board. And I think that is a quality that everybody on this call will share, as well as curiosity and persistence to see something through. Finally, if I just turn to reflections, what I love about my role, and I'm unashamed in it, is the honesty and the candour with which prisoners engage with us about the situation, prison or outside. These informal conversations, which can be shocking and hugely revelatory, lead to issues being unearthed by us, which we can then report up in a way that would never ordinarily happen. And this is another example of how we differ from HMIP and the other structured paid inspectors and monitors. We're there all the time. We have casual conversations, and you can pick up day on day, week on week, the little nuances so that we can form patterns, identify patterns and trends, which was something that earlier colleagues spoke of, and try and get traction however best we can. I think my final reflection is the need to widen the public's awareness of what we do and our other colleagues in these hidden settings of hugely vulnerable people. And many of us, you know, it's only one bad decision away from ending up in there yourself. There's all kinds of people that you meet in places of detention. And I think that is one of the reasons why myself and my other IMB colleagues find the role so compelling. I will stop there and happy to answer more questions later. Thank you.
Thanks ever so much, Camilla, for your insights. Really appreciated. It will come back to you as part of the panel at the end. I'm now introducing Nathan Bryson, who's an Inspector for Adult Social Care and Quality Commission and brings expertise in assessing the quality of care services for adults, ensuring that people in detention receive appropriate standards of care. Over to you, Nathan. Thank you.
Well, thank you. Good morning, everyone. So my name's Nathan Bryson, and I'm an inspector, an adult social care inspector, at the Care Quality Commission, the CQC. So I'm delighted and honoured to have the opportunity to speak with you today on behalf of CQC to provide you with an overview of our role as the national preventative mechanism for health and social care in England, to describe CQC's human rights approach to regulation, and to provide a frontline view of the operational practice in helping to protect people from poor care, neglect, and ill treatment. So some of what I'll be sharing with you today does include an element of distressing detail. However, the examples I'll be sharing do represent the real lived experience of people who used those services. So CQC's role is to make sure that health and social care services provide people with safe, effective, compassionate, high quality care, and we encourage services to improve. Care that does not respect and promote human rights is neither safe nor high quality. And as you've already heard, we also participate in joint inspections of places of detention with other regulators and inspectorates across England. So CQC's human rights approach, which was refreshed in 2022, is based on the FREEDA principles of fairness, respect, equality, dignity and autonomy, and states clearly that there can be no good care without this rights respecting care. A human rights approach to care and support seeks to ensure the human rights of people using services are protected and promoted by staff and services, and is based on shared values like dignity, fairness, equality, respect and independence. And our existing regulatory and monitoring powers enable us to visit and inspect settings where people might be subject to detention under the mental health law and deprivation of liberty safeguards in health and social care. And in most care homes, mental health hospitals and other hospital settings, there will be people detained or deprived of their liberty. And just to add, in respect of the deprivation of liberty safeguards, in CQC's most recent state of care report, we go into detail about this area of our work, so I'm not going to attempt to cover it here. However, it is important to stress that the practical application of DOLS in a care setting is a key assessment area for us as frontline inspectors. So the UK NPM guidance highlights important skills and approaches that can support a focus on preventing ill treatment when monitoring and inspecting settings where people are deprived of their liberty. And these are centred around curiosity, critical thinking, clear communication, courage, interpersonal skills, tenacity, attention to detail, self-awareness, and knowing when to seek help. So that now leads me on to my experience of inspecting services where people were subject to DOLS and where I exposed close cultures, poor care and ill treatment. And just to add, by close cultures, we mean a poor culture that can lead to harm, including human rights breaches such as abuse. And in these services, people are more likely to be at risk of deliberate or unintentional harm. So in my first example, I'll simply call it Care Home A, a service registered with CQC to provide accommodation, care and support to 19 people. Most people who used the service were older, they were living with enduring mental health support needs and were made extremely vulnerable by their circumstances. On the first day of inspection, I conducted a tour of the premises and found significant areas of environmental concern, including rodent infestation and carpet bugs. And actually, one of those carpet bugs crawled up my leg whilst I was sat in the communal lounge. These were clearly an immediate and obvious red flag. Within less than an hour of being on the premises, I was on the telephone to my manager requesting urgent support, and my colleagues responded. An additional team of 3 inspectors and my inspection manager arrived to assist. Now, care staff appeared well-intentioned, but it was strikingly obvious through talking with staff and from our own observations, management and staff had become completely disengaged from people using the service, and there was an apathy across all aspects of the home. This inevitably had a detrimental impact on the quality of care being provided. In the laundry basement area, we found filthy conditions, including soiled items of clothing and bedding that had been thrown onto the laundry floor. Bait traps for vermin were located throughout the home, including in residents' bedrooms. In one bedroom, we found an overpowering smell of urine, and the carpet was damp in places due to urine contamination. In the second bedroom, on the first floor, we found a person with limited mobility, which meant they were wholly dependent on staff. Placing this person on the first floor increased their risk of isolation and loneliness. The environment in their bedroom was almost uninhabitable, with broken windows, tatty bed sheets for curtains, and soiled bed linen. I gently spoke with this person, and they stressed that they didn't want to cause a fuss, but their main complaint was the fact that they were vegetarian, but the only meal that they were being served was roast potatoes and a few vegetables boiled from a frozen packet. I asked about the conditions in their room, and they stressed again that they didn't want to cause a fuss. This person had become totally disempowered and in fear of speaking up to staff. Now, as part of CQC's inspection methodology, we use a short observational framework for inspection known as SOFI. This is an evidence-based framework for directly observing and reporting on the quality of care experienced by people who may not be able to describe this for themselves. It is used in our inspections of care homes and hospitals. So in the dining room, we observed 2 people to be seated long after lunchtime service had finished. One person was seated adjacent to the wall and asked a member of staff on several occasions to be taken to the toilet. But the carer simply stated they were too busy and would be back in a minute. However, that minute never came, and we intervened and asked staff to tend to this person's personal care needs without delay. For another person that we observed, we saw that they were non-verbal in communication. We therefore looked at their care records and found this was associated with sensory loss and deafness and long-term mental health support needs. However, no aspect of this person's care and support plan made any reference to these additional needs, and staff had not received any training in this area. Engagement with this person was meaningless, and staff simply gestured and shouted directions at them. Now, during this inspection, a community psychiatric nurse attended the home to visit one of their patients. I took the opportunity to speak with them and seek their views about the conditions in the home and the poor quality of care that was evident for all to see. The response from the CPM was, well, people like them need somewhere like this. In respect of this particular care home, significant enforcement action was commenced almost immediately. People were moved out and into accommodation that met their needs, and the home was closed within 5 days. Now, the issues highlighted in that example were mostly overt and could not reasonably have been missed. But in many cases, ill treatment and abuses of a person's human rights can be more subtle and less obvious. So, for example, in another care home, I observed people sitting in the communal lounge in armchairs, but we saw that staff were deliberately placing overbed tables and Zimmer frames directly in front of people and wedging them into their seats. When we asked, staff told us this was simply to stop people getting up and falling. Staff had totally disregarded the fact this was restraint and an abusive practice. Now, in the final example to share with you, a person disclosed to an expert by experience supporting the inspection that they were being bullied by a particular member of staff. And as you've already heard, CQC uses experts by experience, and these are people with lived experience of using services or experience for caring for someone who does. And the involvement of X by X's is integral into CQC's inspections. The expert by experience discreetly shared this information with me, which meant I was able to review this person's care records and complete again another period of observation in the line of sight of the person and with staff. I directly observed the perpetrator speaking to this person in an abusive and inappropriate manner, supporting what had been disclosed to us. On speaking with the registered manager, this issue was already known to them, but they were totally dismissive and simply said the person had a history of making things up. So to conclude, these examples describe when people are deprived of their liberty for any reason, they are at more risk of ill treatment. For people detained in these kinds of rights rejecting environments, as an inspector, we are some of the last advocates championing their rights and protections. Having a prevention focus for me in my work means being proactive, flexible, and human rights led in monitoring places of detention, making interventions where necessary, and encouraging continuous improvement to prevent ill treatment. Now, clearly, I've highlighted some of the examples here of poor care, but it is important to stress that there are also many examples of good and outstanding care across health and social care services in England, with many dedicated, caring and committed managers and staff working in those services. Thank you for listening.
Huge thanks, Nathan, for your insights into adult social care. Really appreciated. We'll come back to you as part of the Q&A at the end. I'm now going to hand over to Isabel Faggioli, who is the Digital Communications Officer and Criminal Justice Inspection Northern Ireland. As part of the CJI communications team, Isabel has helped to communicate CJI's findings and promote transparency in the justice system. Thank you. Over to you, Isabel.
And thank you so much. Right, so good morning. My name is Isabel Faggioli, and I am the Digital Communications and Business Officer at Criminal Justice Inspection Northern Ireland, or CJI. It is a pleasure to be part of this panel, and I thank the NPM team for this opportunity to speak, and everyone here for taking the time to listen to what we do at CJI from a communications perspective. So for a little bit of context, CJI is an independent statutory inspectorate in Northern Ireland, and we examine all aspects of the criminal justice apart from the judiciary. My role in CJI is to leverage digital communications to ensure every inspection published is communicated to our key audiences and the community in an effective and engaging way. But what is behind an inspection publication? Well, there is a detailed communication strategy behind every publication, which could be a full inspection, a follow-up review, or a specific review requested by the Minister of Justice. But for the purpose of today and this presentation, I will be referring to inspections to cover all those three types of publication. Our aim is to produce content that is accessible and easy to understand for all our audiences. And that's why we create a suite of written, audio, and visual communications material that allows our stakeholders, including politicians, voluntary and community sector bodies, academics, partner inspectorates, and the community to choose from the format that best suits them. And this includes an inspection report, a key facts document that summarizes the core findings, infographics document that provide a visual messaging linked to the key themes, a press release to highlight the key findings of our inspection, and that is shared with our media to raise awareness of our findings and the recommendations made. A short video featuring the Chief Inspector and Lead Inspector giving an overview of the report, a podcast episode featuring the inspector organization or organizations, and sometimes, where relevant, other stakeholders. We also have social media content to publicize our inspections and support direct engagement with our audience, and where appropriate, an easy read summary of our inspection reports, which are targeted to specific audiences, including prisoners and young people, and these are particularly relevant in an NPM context. So all of this communications material is included on the report page of our website, and the website has been recently redesigned to improve our engagement and the user experience of those visiting the site. In fact, if you have time, I would invite you to have a look at it, and if you want to give me your feedback, you feel free to do so. And now I want to ask you, and you don't have to answer, but I just want you to think about the answer. From this communications material, which two do you think get the most engagement? Well, our data shows that the most popular route to learn about our inspection findings are through our inspection report and our podcast. So yes, people read the full inspection report, which is reassuring. But launching our CJI podcast, which is called Criminal Justice Inspection Unpacked in 2023, we have seen a sustained audience growth. And to give you an idea of this, in the last 12 months, our downloads have increased 67% and our listeners have increased 86% in comparison to the previous year. So in an increasingly challenging communications landscape where criminal justice issues face more competition than ever before from health, education, the cost of living, and the entertainment sectors, media focus tend to be on the negative rather than the positive story, and we are required to work harder in more innovative ways to ensure our messages reach our audiences. So that's why our podcast has provided CJI and the inspector organizations and other stakeholders a new communications opportunity. It provides an avenue to talk about the criminal justice system and the issues and challenges an organizations face, to explain what it's been done to secure improvement and how inspected bodies are responding to inspection findings. It is a space for constructive discussion and accountability. more transparency, and increased knowledge and understanding with the aim of fostering public confidence. But as we said, with anything, there are limits to how much awareness we can generate around an inspection. And we face challenges such as the different levels of public interest. Not every inspection has the same resonance with the community. Some focus on specific areas of the criminal justice system, while others are more relevant to those working in criminal justice. We have competing business priorities. We are a very small organization, and like most smaller bodies, our communications team carry other business responsibilities that must be balanced with our communications work. We also have limited resources. We rely on the participation and support of our senior leadership team and our wider staff group to deliver our communications activity and engage in digital content. We are very grateful for the willingness to participate, but this commitment needs to be balanced alongside the delivery of our annual inspection program and staff availability. I also wanted to share with you other effective ways we raise our profile of our work. These include giving briefings to the Minister of Justice and her departmental officials and our inspection findings on our inspection findings, and also give evidence before the Northern Ireland Assembly Committee for Justice and its all party groups when we are requested to do so. We also regularly engage with other criminal justice organizations about our work, and we accept invitations to speak to the voluntary and community sector bodies at conferences. We also talk to students at our local universities, and we attend other key events. Lastly, but not least, I wanted to share how we incorporate our NPM work in our communication strategy and our ongoing activity. So we see our role as a member of the UK NPM as central to our work as an independent inspectorate. In our current 3-year corporate plan and this year business plan, we are upfront about our commitment to fulfilling our responsibilities as a UK NPM member and our support to the OPCAT obligations. We serve as the regional representative of the Northern Ireland on the UK NPM steering group and chair the Northern Ireland NPM subgroup. This is reflected in our communications activity by featuring the UK NPM logo in relevant inspections and also all the supporting communications material. We have a dedicated space in our website for UK NPM work and reporting about our work in support of the NPM on our annual report. We highlight our statutory role and responsibilities as a NPM member with the Department of Justice. We promote the objectives of the NPM and our role in working to protect the rights of those in detention during speaking engagement and media interview. We also work closely and regularly with the UK NPM and our NPM partners in Northern Ireland and promoting awareness of the NPM work through digital communications where possible. And you can see a few examples of pieces of work where we have worked together. So that's it. That wraps up my presentation, and I hope you found this information interesting. If you want to find out more about what we do, you can follow us on social media or visit our website or even send us an email. This is quite different to all the other speakers on the panels, but I hope this was interesting and useful. Thank you.
Thanks ever so much, Isabel. It was really interesting, and particularly for me as a comms professional, so thank you. We're now going to hand over to John Eyre. John is a senior manager on the local authority team at Care Inspectorate Wales. John leads the team in inspecting secure accommodation services for children in Wales. Over to you, John. Thanks ever so much.
Thank you, Rachel. Much appreciated. Good morning, everybody. It's a real privilege to be here and speak to you guys. I've got 8 minutes, so I'll be getting on with it, I think. So I'm speaking to you here from Cardiff, capital of Wales. Thanks, Nathan and Isabel. I really enjoyed hearing what you were saying because it's very helpful. Where you're from, we're nestled right in between England and Ireland here, so it's good to go in a nice order. I'm talking about challenges, successes and reflections. So thank you, Rachel. I'm a senior manager in Care Inspectorate Wales. I lead inspections in adult and children's services across Wales. In CIW and Care Inspectorate Wales, we've got 4 teams, and between us all, we cover we inspect all of the social care and register all the social care in Wales. Of course, we're talking about beyond just local authority care here with NPM work. So I think it would be helpful to look at this in two ways. Firstly, how we can be reactive to circumstances, and then how we can be proactive. The two main areas that get to the heart, I think, of what we're talking about this morning are, as we've mentioned already, deprivation of liberty orders, and Nathan, you gave some really helpful examples about that. Thank you. From a reactive point of view, as an inspectorate, we've got some very specific powers as far as reacting to that. We can use specific enforcement powers when we need to. Now, looking at deprivation of liberty orders, I think it'd be helpful to look at it as well with operating without registration. So I'll explain that a little bit more. But I think looking broadly, certain things are simply criminal offences when it comes to this work, particularly operating without a children's home without registration. So under our risk laws, we can conduct criminal investigation and prosecutions, and we have done it in the past to conviction. We've got 2 ongoing at the moment. Having said that, we are very proportionate with that and sensible in the way that we manage it. I think examples are helpful here, and Nathan, yours were great. I have to say, great examples of what you're saying about the adult care. I'll stick with children. I think it'd be wise for me to following the help you've given us already. Now, an example for a real life example from some years ago, from a previous role of mine actually, was a legal children's home. So the home isn't registered. The local authority has got a responsibility, a very strong duty to place and take care of that child, and they don't find a registered placement for them. So they sometimes put together what can be described perhaps as an ad hoc placement for the child with an ad hoc staff team. It could be an Airbnb. In one situation, it's genuinely a caravan. Whether that happened in that's happened over time. But one particular example was in a house. It's legal restraints used as a way of managing behaviour for children. So you can imagine all sorts of scenarios, but this particular scenario that I came across in a previous role, the restraints were so serious that one person had to be physically removed from a child when restraining them because their knee was over the child's neck and the child would stop from being able to breathe. And this is in Wales. This is in the last few years. This occurred. So it's rare. Doesn't happen very often. I haven't come across anything that sits in this role, but in a previous role, I have 1 or 2 situations like that. So this is where we can be reactive, and simply by having a child in an illegal children's home, that's an illegal action. We do work with the local authorities to try and resolve that, and we monitor and ask for a strong assurance from them. And the team I work in, the local authority team, we often speak to directors or head of service directly to find out what the reality is, how we will be resolving this, and work with them. But where that doesn't work, it can lead to us prosecuting them. So deprivation of liberty orders is slightly different, but I think it's probably enough to say that we've got a range of powers, including urgent enforcement action and cancelling people's registration when it comes to these things. Of course, the courts are more well placed to do similar prosecutions in that area. But we do produce an annual All Wales report on the deprivation of liberty covering adults and children every year. I was with that not too long ago. Please have a look on my website if you want to have a look at that. So that's probably a very quick touch on how we can be reactive. Our registration team, who I work for some time, they work with other areas of COW, and we can simply cancel registrations if we're concerned enough. We can do a whole host of other powers as well. And of course, that may turn a children's home into a legal children's home if we cancel the registration. We have a course to do that. So that's covering, I think, enough our reaction to this. Of course, as was mentioned near the start of today, I think we have to just touch briefly on OPCAT's focus on preventative work here, and the emphasis on systemic prevention here. So I want to shine a bit of a light on, in Wales, how we specifically manage proactive work to avoid deprivations of liberty and and all sorts of harms. So and Wales have for some time now devolved powers. We had our own social care law, Social Services and Wellbeing Act. Now, looking very broadly here, there were 4 areas that we focused on: voice and control, prevention, well-being, which is a lot of that is safeguarding within well-being, and partnership working. So touching on a few points there, in order to strengthen systems and strengthen work, we're very focused on, for voice and control, advocacy rights. We've got very strict expectations about local authorities and other people using advocacy rights, trauma-informed practice, and prevention of, as I've said, prevention of unnecessary restraint. So championing people's voice and control, adults and children, is very, very, very strong in our legislation, and we very strictly inspect against that. Prevention, in the presentation from Maria at the very start, I mentioned already the OPCAT's systemic prevention, but we look at a whole range of preventative services that exist in local authorities in order to prevent escalating need that may lead to harm for children and adults. And that forms a very big part of our inspection work, and it's also a lot of it's done in partnership with other agencies and heavily monitored, and a big part of the good practice we try and drive up within Wales. We can't talk about this without talking about wellbeing and safeguarding. There's a very strong duty in our legislation about duty to protect from abuse and neglect, and when that doesn't work properly, as I've touched already on the reactionary measures, we have escalation routes particularly when those things aren't working, and that may involve Welsh Government, may involve difficult discussions with directors and chief execs, but we have systems in place. I have to say, you have to use those. I'm very encouraged by this. We don't have to use those very often, our escalation routes. Largely, we can manage anything we're not comfortable with simply on a relationship basis with the local authority, which I'm very pleased about. But it does work quite well. I've already touched on partnership as well, about local authorities have to work particularly with health, education, probation, lots of other partners, the police, about multi-agency work in order to prevent escalation of harm and prevent things going wrong at all. So that's kind of a snapshot of the what and how we do things, very, very, very service level. Sally, I think it was something you said just a bit earlier about calling out, if I'm right, Sally, calling out bad practice is something that we have to do. I think that's very relevant to our what we've been asked to talk about this morning: challenges and successes and reflections. I think calling out bad practice is a challenge, but it's an essential thing that we have to do, and it's about how we do it. And I was told when I started this role with the local authority team that a lot of this role is about relationship management. And if you manage your relationships with the senior people in local authorities that we work closely with, then you're able to challenge in a constructive, respectful way that gets results, avoiding defensiveness and avoiding people reacting back and being a bit blind to what the reality is from your inspection. But a lot of the challenge is managing those relationships and doing it proactively and respectfully. And I found that that's actually absolutely true. And you get a lot more by being kind and respectful, but very clear, very straightforward, and very honest about the evidence that sits in front of you that you have to share with them, which I did myself at the start of this week with the head of service. So the challenge, that's part of the challenge. The other part of the challenge is just being really good at getting evidence. And if you're going to have a point of view in an inspection report, be sure you've got the right evidence, weight the evidence really well, make sure that you've got evidence to back up what you're saying. So everything's watertight, and you've got that good relationship. That's when you lead to improvements. So going on to successes, I would say the measure of our success, really, I think, for inspectorates is you go into a service, you inspect it, you have a report, make recommendations, maybe more strict than that, hopefully not. And then you go back a period of later, after a period of reflection from them to improve those services. You go back and what we call an improvement check, and we go back and check if they've done what we've asked them to, and those services are better because of your work. That is success. Now, bearing in mind, we focus a lot on prevention and to prevent the escalation of need and harm for people. Then, if we then reflected a bit and thought about, well, what harm have we prevented, and what good has resulted from our interaction with local authorities and other services, then I'd hope that would be many. But I think that's probably the best measure of our success. There's all sorts of feedback mechanisms, but that and long-term demographics is probably the two main successes I would say. The only thing I'd attach to that is probably being a challenge and make things successful. Make sure we've got our priorities right, looking at the right things and putting our energy in the right places. And it's all about impact on people. If it doesn't matter to people what we're asking to change, it really doesn't matter at all. It's all about impact on people and improving that. So focusing on the right things. So the last thing is reflections. I would say it's critical for anybody doing this work in order to be successful is to focus on continuous improvement and be kind but courageous and fearless when it comes to having those difficult conversations with people to affect change. As long as we're championing the rights of the most vulnerable people, then we're doing a good job. And if it's painful sometimes, that's difficult, but we manage those relationships as best we can. I'll finish by misquoting Gandhi a little bit. I've kept this in my mind. Whenever I've had new challenges work-wise, I thought something that Gandhi sort of said was that it's a good measure of a society that makes sure it treats well the most vulnerable people in that society. So thank you.
Thanks ever so much, John. Really appreciate it. We'll come back to you also as part of the panel at the end. So our final speaker for this panel is Jenna Wallop, is the Membership Engagement and Training Manager at the Independent Custody Visiting Association, otherwise known as ICVA. Jenna supports the schemes and volunteers responsible for monitoring police custody across the country. Over to you, Jenna.
Thank you very much, Rachel. And today has already been incredibly insightful. I've learned a lot from all these different detention settings. So I just wanted to thank the MPM as well for putting this event on. So as I was introduced, my name is Jenna. I'm the Membership Engagement and Training Manager at ICVA. I have a human rights background educationally, but I've been working with ICVA for over 3 years now. And amongst other things, my job involves the training created for the custody visitors who go into police custody to check on the rights and well-being of detainees, as well as the membership management, so working with the people who run the schemes and collaborating on policy work with the CEO, Sherry, who you heard from earlier, and other colleagues. So I'm going to talk to you a little bit about how we incorporate the preventive mandate how I incorporate it in my day-to-day job, as well as weaving in our challenges and reflections throughout. So I'll start off with training. So I create all of the training for ICVs nationally, in which I include human rights elements in all of the modules where applicable, as well as having a separate human rights module entirely about human rights overview, as we're aware that there is a lot of terms and a lot of abbreviations and acronyms and all that, and especially a lot of alienating language in the realm of law and legal things. So we wanted to make sure that this basis was understood by independent custody visitors as well as understanding that they are part of something bigger, something huger, the National Preventive Mechanism. So another example is in my most recent learning module that I created for our e-learning platform, which is brand new. I created a module about learning disabilities and difficulties in custody, where we use an example from the European Court of Human Rights, which is ZH in Hungary, which is a case where in a detention setting, it was ultimately found as a breach of Article 3, which is the prevention of torture in the European Convention. It was found as a breach because he was unable to access his rights in a way he was able to understand due to his multiple learning disabilities. So using examples like this can help custody visitors understand how this can go wrong, essentially, and what we can do to prevent this. So, for example, with this particular example, looking at our individual rights looked at, our individual needs looked at, are things given to detainees in a way that they can understand? And is this done, again, on this individual basis? Further, we also use and adapt MPM materials into our e-learning, such as our MPM module and our induction training. So we've got a huge induction training for new ICVs, which went live last week. And this induction training has a whole separate module on the NPM and preventive monitoring. So it discusses principles of preventive monitoring, such as the talk, observe, review and follow-up model, where we encourage ICBs to talk to detainees in custody, observe the culture in custody, again, which some other speakers have talked about already, is the culture being a really integral part of making sure that people are being looked out for appropriately, and that they are monitoring things to do with, for example, respect for detainees and dignity as well as interactions with detainees. We also look at reviewing custody records and pre-release risk assessments, for example, following up by raising it in their reports and ensuring that the scheme manager has the data they need to escalate where appropriate. So I have two small examples from ICV Impact from this preventive approach that I thought would be nice to share, just as some positive impact from what you guys do. So I could name 100. I get quarterly statistics with so many amazing things that ICVs get up to, as well as, of course, causes for concerns, which we are working on, and good practice. But I would like to shine a light on the independent custody visitors and the fantastic work that they do. So there is one example of a detainee who had not let custody staff know that they were actually unable to read. This was then brought up in a visit with a custody visitor, who had then brought it forward and made sure that they received everything in a format that they were able to understand, despite not being able to read, which is, of course, a very sensitive topic and something that you might not feel comfortable saying to someone in a uniform. Again, emphasising that importance of preventive monitoring and making sure that detainees are given the opportunity to speak to someone who isn't in uniform. This means that the detainee was then given everything that they needed in a way that they were able to understand, and also some learning from custody going forward to ensure that they are able to ask things sensitively and pick up on certain things when it comes to those sorts of topics. Another example, which is a very direct example of prevention, is we had a report of a detainee who had very sadly expressed intentions to harm themselves. This is something that they had only expressed to the custody visitors, again, because of that barrier being broken down and that rapport of speaking to someone who is just a person like you. In this instance, the custody visitors took the appropriate steps needed to make sure that this detainee was safe. Their observation levels were amended and they were monitored in a more detailed level. And this meant that they have potentially saved a life, which I think is one of the most fantastic examples we have at the moment. And I would like to say very well done to the ICVs who did this. And thank you for going into custody and looking out for detainee welfare and well-being. And yeah, thank you for giving up your time to do so. So that is just two examples, I would say small examples, but amazingly huge examples for these individuals involved. So those are just the examples that I came up with. But like I said, we have so many times when ICVs create fantastic opportunities for people in custody, even with small things, from making sure that they're being fed and watered, making sure that they've got enough blankets, to bigger things like potentially saving lives. So in terms of membership management, which is the other element of my job, I ensure that members feel empowered to scrutinise effectively and are armed with the appropriate human rights knowledge to do so. I do this through ad hoc queries, so essentially our scheme managers can ask me anything they like, and then hopefully I will have an answer for them, and if not, I'll direct them to someone that does. We also have training for our managers, so we do train the trainer sessions for them to make sure, again, that they are empowered to be able to answer to any challenges raised by custody visitors. So say, for example, a challenge comes up in custody that they're not familiar with, they can always come to us and we can sort things out with them. We also attend regional conferences and where capacity allows local, so that we can help share knowledge, but also get to meet the ICVs that do this work, which is really fantastic as well, just on a personal level. I really enjoy meeting you. And then also we have our quality assurance framework, which we have in place to support members to benchmark in terms of what good practice looks like. And help empower them to scrutinise as effectively as possible, as well as implement any changes and empower them to do so through this framework to achieve certain levels. That's how we support our members in doing this. Policy work. So ICFA also incorporates the spirit of OPCAT mandate in their policy work. So most recently, we've worked on amends to the Home Office owned Code of Practice for custody visiting, which outlines the duties of custody visitors and the remit of their role. So we aimed to update it, but also to ensure OPCAT compliance. So, for example, through strengthening the principles of access per Article 20, through emphasis on looking at custody records and some clarity surrounding what ICBs can and can't see, and more robustly ensuring functional independence as per Article 18 through amends to eligibility criteria and a robust and detailed conflict of interest framework to, again, hopefully empower scheme managers to make those decisions on who is eligible and who might be a conflict and how those conflicts can be mitigated as well, so that the Code of Practice in general becomes more OPCAT compliant. These amends have been suggested to the Home Office now, and we are waiting a response, so I don't have an update on that for you yet. But this is another way in which we ensure OPCAT compliance, which also, again, shows our challenges when it comes to OPCAT compliance, where we don't believe that the code as it stands is necessarily compliant in all areas. So that is something that we would be really interested in taking forward. So that's just a quick whistle-stop tour from me. I'm aware that we're running over just a little bit, so I would like to thank you for your patience. But yeah, thank you very much.
Brilliant. Thanks ever so much, Jenna.
We are now moving on to... so we're going to hand straight over to Camilla Cader, who is the Director of Nursing at Broadmoor Hospital. Broadmoor is one of England's 3 high secure hospitals and offers care for men over the age of 18.
I think at Broadmoor Hospital, it's one of the 3 high secure hospitals within England, and it was first established in 1863. We are at the forefront of secure mental health services, as we are only 3 high secure hospitals with a capacity of close to just over 700 patients in the country. We provide care and treatment to detained patients under the Mental Health Act, and the patients' conditions can pose a significant risk to themselves and others. Our patients require highly specialized environments and offer both safety and require the right support in order for them to recover and rebuild their lives. If you could move on to the next slide. Thank you. So in this slide, there's a pictorial diagrams of the old Broadmoor and the new Broadmoor, and I think there's some significance in showing that. So across secure hospital settings, secure hospital settings are the crossroads for health, human rights, and justice. Every day, we strive to embody a unique balance between care and authority, including accountability. At the heart of our mission at Broadmoor is to maintain ward safety and support genuine patient involvement in their care and the decisions around their care. This is a clear and uncompromising duty we have in order to deliver compassionate and evidence-based care within the lawful framework of detention. We have to balance this with security, but it should never overshadow the fundamental purpose of rehabilitation within our service. We hold on to things like respect, dignity, and proportionality in terms of principles that are reflected in OPCAT. Our modern purpose-built facilities do more than just meet the standards. They raise the bar, creating environments that support recovery and safety and set the expectations of governance, clinical quality, and operational oversight. In the old Victorian buildings, for those who've ever visited Broadmoor, will note that our facilities weren't fit for purpose, and that was one of the inspection findings in previous CQC inspections. And fortunately, we were lucky to have the funding to build a new hospital. So crucially, our alignment with UK's NPM means our purpose is open to independent scrutiny and continuous challenge. And I think this is what sets us apart in terms of the practice and what we do. Could you go on to the next slide, please? Again, that slide highlights the modern facilities that we have. That is exactly how Broadmoor looks today. And in terms of the organizations, sorry, I am missing a slide. High secure services sit at the crossroads of human rights and justice, and this is what we do every day. At the heart of our mission is to maintain ward safety and support genuine patient involvement. Around this here, we're talking of national prevention and safeguards. Organizations highlighted in this slide each play a role in the detention and care of individuals. We all work within established oversight frameworks, such as the CQC, NPM, and OPCAT. These frameworks are not just technical structures. They are designed to bring a preventative human rights-focused approach to inspections and improving conditions across all the places of detention. At their core is a simple but powerful idea: upholding people's rights. People who are deprived of their liberty should be seen, they should be heard, and the conditions and care they experience should be subject to regular independent scrutiny. It isn't only about preventing ill treatment, it's about making sure that those in detention receive dignified, respectful care and in safe therapeutic environments. Broadmoor plays an active part in collective national mission. We do this through our standards of care, our policies, and the way we work day to day. Our aim is to ensure that our patients are cared for lawfully, safely, and with compassion. By doing this, we are contributing to the UK's wider commitment to uphold international human rights and strengthening accountability within the secure mental health services. Next slide, please. This slide, I'll talk a little bit about shared priorities across the sectors. Our shared ambitions are clear. It's to reduce the use of restrictive practices wherever possible. Within our service, we have patients who are detained under the Mental Health Act. We have patients who could fall under seclusion. We have nighttime confinement, and all these practices. We have to ensure that we use the least restrictive options when caring for our patients. Whatever role or whatever our sector, we are united in the common purpose to keep people safe, act quickly and thoughtfully when crisis hits, and to create environments where restrictive practice are the exception, not the norm. This involves our commitment to ensuring recovery, safety, and dignity, and the determination to minimize unnecessary detention and unnecessary restrictions. We stand for care that restores hope, not care that confirms it. The realities are we all face real challenges, and I'm talking this is across services. Demand for services is high, resources can be stretched, and situations can be complex, but that only reinforces our responsibility. Together, we have a duty and the opportunity to deliver care that is just, clinically effective, but deeply compassionate. Could we move on to the next slide, please? On this slide, it just makes reference to the partnerships that we involved with high secure services. There's a simple truth here. No single agency can do this alone. The journey from first contact to discharge makes that clearer. And as an example, from the very first moment of police contact through assessment, admissions, treatment, and ultimately discharge, it is the strength of our partnership that determines the quality and consistency of our care. When we work side by side, sharing information, sharing insight, and sharing responsibility for risk, we close the gaps where people might otherwise fall through. Ensuring individuals receive consistent, compassionate support throughout their detention journey. There are initiatives like Right Care, Right Person, which give a real-world example of collaboration in action, ensuring that people in mental health crises are seen by professionals with the right skills, training, and experience of their needs. And in Broadmoor, we have an MDT approach, which is a multidisciplinary approach, which is a full establishment of several professionals. That is not just good practice. It is it's humane in motion. It means responding in ways that are compassionate and appropriate, and reducing reliance on services, for example, the police, where their involvement is not necessary. Could I move on to the next slide, please? So the partnerships are also about routine habits, regular joint reviews, open and honest conversations, and the use of independent assessment to bring fresh perspective. At every stage, partnership and transparency are our cornerstones. They are what allows environments of custody to remain safe, fair, and truly therapeutic, not only for our patients, but also for our staff who bring their energy, professionalism, and compassion to this work every day. So in line with the duty bearers under scrutiny, high secure hospitals sit at the center of a complex interconnected network that includes the police, the criminal justice system, His Majesty Prison and Probation Services, and the CQC. That's just to list a few. We all have our own pressures and priorities, but together we form a framework that is designed to safeguard the most vulnerable people in our society. For those leading and delivering care within our services, the spotlight is on external scrutiny and can feel intense and uncomfortable at times. But the scrutiny is also one of the most powerful drivers for improvement. Oversight and inspections are not just technical exercises in governance, they are visible expressions of our shared accountability and our commitment to being transparent and doing things better day after day. So we've had experience over many years of inspections as a high secure facility, and most recently we've had an inspection in July and our rating was good. Coupled with that, we also have to work consistently within the legal frameworks which shape our work. This is the Mental Health Act, the Human Rights Act, and within OPCAT. These don't just set the boundaries, they are the anchor in us, in our values of dignity, justice, and respect for human rights. They remind us that our duty is not only to comply, but to care, to listen, and to uphold principles that define human and ethical practice. For us, external scrutiny includes inspections and joint work led by the CQC and other members of NPM. It is essential to this. These engagements are not just about identifying risk or pointing out faults. They are also about recognizing potential, supporting growth, and strengthening a culture of learning. Through them, we continue to evolve, adapt, and raise standards of care, treatment, and accountability.
We're going to move over to Andy Poole now, who is Chief Inspector and Custody Lead at Gloucestershire Constabulary and is responsible for overseeing police custody and operations. Thank you.
Hi, good afternoon, everybody. My name's Chief Inspector Andy Poole. I'm a Chief Inspector in the Criminal Justice Department in Gloucestershire Police, and I have oversight of Gloucestershire Police Custody Unit. I've got a background in specialist operations, etc., but I have done duties as a custody sergeant before, and also the PACE inspector duties, and they're the inspectors who ensure that we actually follow PACE for the journey of detainees through custody. So within Gloucestershire, we're one of only, I think it's 2 forces only got 1 custody suite in the county. It's relatively new. It's built in 2015. I noticed some of the comments coming down the side about oppressive environments, etc. And I certainly remember some of our old custody suites, which sort of give that difference you saw with the photographs of Broadmoor there, which were really, really oppressive, literally in the bowels of buildings. But now our custody suite is a 50-cell suite, various wings on it. It's open to sunlight, which strangely the previous ones weren't. So they've got quite a nice bearing in mind it's a custody suite environment. We've just had Warwickshire Police come down literally this week to look at our suite because they're looking at scrutiny through HMIC very soon. And they commented on how light and open and what a difference that sort of environment makes. And luckily in our region, we do have a number of modern custody suites, which just make a complete difference of the working environment. So I can't help but think that's going to change how people feel in their workplace, and then how that will reflect against detainees or for detainees. So what I've been asked to do today is just to consider scrutiny within the police custody environment. I did then think, do I think I'm scrutinised, or our environment scrutinised too much or too little? And then, of course, the Panorama programme happened, which would give me a very difficult argument to say that we're over-scrutinised. But I'll just go through what scrutiny we do have, and I don't know what's been discussed earlier because I can only join later on today. I did see Jenna from ICFA on here, so I'll probably skate over some of the ICV comments I had. Luckily, they're really kind, Jenna. So the main inspectorate we have is HMIC FRS, which is His Majesty's Inspectorate of Constabulary's Fire and Rescue Service. I did put a line a little bit further down about how some might feel about HMIC FRS, and I compared it to Ofsted, my wife being a 30-year teacher come deputy head, and then I realised we've got Ofsted on the call as well, so I'm going to cut that short there. We've also have independent custody visitors, which have obviously been discussed this morning. We have independent scrutiny of use of force. So within the custody environment, we have CCTV in pretty much all areas. Police officers have body-worn video now, and they're encouraged to use that even within the custody environment. And then we will be inspected through HMIC to ensure that we scrutinise a good proportion of those use of forces which happen in custody to make sure they are right and just and proportionate. We also have independent scrutiny of strip searches. Again, we use for both of those I've just mentioned, we use ICVs, independent custody visitors, to sit on our panel to give that external scrutiny, so it's not just us marking our own homework. And we particularly look at strip searches of children. Very rare through. We try and avoid children obviously coming through custody, as we quite rightly should. And within a county like Gloucestershire, we probably have 3-4 strip searches of children through the year, and when we do, we scrutinise them to make sure they are necessary. And there was no way we could have avoided doing those by constant supervision, etc., for example. So we also have a healthcare professional 24/7 from an independent company within our custody suite. We have local drugs workers from a company, and they're also embedded into custody. We also have criminal justice and liaison diversion workers cleared and vetted to work in the custody unit. And of course, as I just mentioned, we have 24/7 audio and video recording in all of our custody suite areas. So I think I can reasonably say that I think we are pretty well scrutinised. And I'll just take a couple of minutes, just a very quick, because I know we're running late on time, just to scan over a couple of those areas. One obviously is HMIC FRS. Gloucestershire have just been given notice of the 2025-27 inspectorate. HMIC FRS have now embedded a inspector within the constabulary, so we can build a relationship with that person. They can be very open and honest about the questions they're going to ask of us, and that lightens, it makes the inspector a little bit more it doesn't make it any less informal, but I suppose it allows us to build relationships with the inspectorate rather than just having a group of people we've never met before just drop in on day one and then become under immediate scrutiny. So certainly as somebody on the receiving end of scrutiny, that makes things so much more comfortable, I suppose, for me particularly. The appeal inspection is a continuous improvement inspection, so they will keep visiting us, and any comments they identify will be raised on future inspections to make sure we've actually done what we've said, what they've said we should be doing. And their ultimate aim is to ensure that how good is the force at providing a safe and lawful custody environment. And then out of that, very similar to Ofsted, we get given a outstanding, good, adequate, requires improvement or inadequate. And then the other main inspection we have, and I'll just scan over this really because I think Jen has covered an awful lot of this, is our independent custody visitors, visits to custody. And what I will say is that this is not necessarily such as informal in that we have this a regular group of independent custody visitors visit our suite regularly. I meet with the custody visitors every month. They are run by the IOPC's office. Because of that, we quite regularly have face-to-face meetings. They obviously are involved in the other scrutiny panels that I've just mentioned. So we do build quite a good relationship, which allows them to be very open and honest and say, look, and some of the comments I tend to get is generally around cleanliness of the suite, or around records have been missing from custody records, etc. So it allows us to have a deep dive to explain why that may be, and then to push back and to make sure we improve on those areas. So I am literally going to scan over all those other bits of notes I've got there, because that was pretty much around what the ICV is about. And I know Jenna's covered an awful lot of that off, so that's helped me out no end. Thank you, Jenna. And then I will probably just go on to some conclusions here, really. So I believe that police custody areas are exceptionally well scrutinised. Like so many areas within policing, there are still absolutely opportunities to improve the efficiencies of those inspections. Within our custody suite particularly, it's a 2015 suite, so it came in on Windows 7 and has our CCTV recording is reasonable quality, but is downloadable onto discs, and a lot of our new recruits have to Google what a disc is to start with. So we are having that replaced, and then some custody suites have got AI-driven monitoring of CCTV, so that they can identify, so that the systems could identify unusual movements, whether somebody might be suicidal, self-harming, etc., or stopping breathing. So there's lots of opportunity still for us to move forward on and to improve. So I think I'm going to stop at that because I know we're running late, and obviously I'll be open to questions a little bit later.
Thank you, Andy. That was really interesting. I had the opportunity to shadow an ICVA visit at Gloucester Police Custody earlier this year, so it was interesting to hear your reflections. Our final speaker is Paul Thomas. He's the chair of the Secure Accommodation Network. The Secure Accommodation Network provides support, guidance and advice to secure children's home. Thank you, Paul.
Thank you. Thank you very much for the invite. Thank you very much for also promoting me at the same time. I am actually the vice chair of SAN, which is, as you've mentioned, is the Secure Accommodation Network, which provides support and guidance and advice to 14 of the secure children's homes in England and Wales, and also also supports the one secure school, which I know Ofsted referred to earlier. So we support all these services to grow and develop a range of trauma-aware and psychologically informed integrated care that incorporates health, education services and specialist intervention. As a group, we meet and share our challenges as well as the good practice, but we also provide 2 conferences annually, one in the winter and one in May. But we also, over the last 4 years, have led on 3 particular leadership and management events to frontline staff and managers to find our future leaders, really, and to address the succession planning and strategies that we and challenges that we have, and provide some support to those inspiring leaders. And certainly over our last leadership and management event that we did in August, or was it September, we had actually over 50 people. That was well attended, and some really positive feedback. So inspection experiences, what does it look like? For secure children's homes and the secure school, we have 2 inspections and assurance visits within a 12-month period. One is a 2-day inspection, with the 3rd day providing feedback, which you will probably find in its realistic around about 7 inspectors who are visiting, and the other visit is a 1-day visit, which is we'll have 2 inspectors, and mainly that particular 1-day inspection is actually focusing on progress since your last inspection, and the particular buzzword that is often used in those particular inspections, insurance and visits is around key lines of inquiry, which is more focusing around we have an independent person that comes once a month that is not employed by us but comes and visits, so they get their reports every single month, but they will also be looking at key lines of inquiries around any notifications that you send to Ofsted as well. So secure children's homes provide accommodation, because I think a lot of the focus today was on people that are in custody for a number of reasons. But, you know, secure children's homes provide accommodation to children, young people on the custodial grounds, but also welfare grounds. It's important to note that as well. So children that are deemed vulnerable to or from the community, we also provide accommodation to through the family courts. And also it's interesting that our Chief Inspector just spoke, we also provide support to children under the ages of 18 who are deemed vulnerable overnight on the PACE legislation. So you know, so in advance of coming today, we have a sort of annual conversation with Ofsted on a regular basis as a secure accommodation network, and I particularly went to a couple of the registered managers who manage some of these provisions, and there is a cross section of there are welfare only homes, there are ones that provide welfare and custodial, and there's also custodial homes as well. So it is a very mixed bag, and suffice to say there was a mixed view on inspections. Just before I look at the experiences, I just wanted to say, similar to my earlier colleague who spoke about his inspection sort of process, we are inspected on what is the Children's Homes Regulation and Quality Standard 2015, and it looks at 5 areas: overall experience and progress of children and young people, children's education and learning, children's health, how well the children are helped and protected, and the effectiveness of leaders. And each of those areas, similar to my colleague from the police, are judged outstanding, good, requires improvement, or inadequate, and an overall judgment is provided. So I always think is of an inspection, and similar to what if my colleagues was here, they would probably be saying the same thing. What can we do in order to ensure that you have a really good inspection? And I have a personal philosophy, is that I do not go into work every single day for inspectors. You know, inspections are not 365 days a year, but our children indeed are wanting that important service to be provided to them. So for me personally, I'm going to say I don't go into work every day for inspectors, but I do go into work for the children and young people that I look after. And so what I say is, what I would say, and I'm sure my colleagues would say, is good preparation of inspection is always advisable. Good preparation in terms of providing good outcomes and showcasing the positive work that you do. But also at the same time, it is also to tell inspectors any shortfalls that you've identified for yourself, and tell them what plans you have and where you are implementing these plans and where you're currently at. You know, show a picture. You know, I often use the phrase show and tell. And ensuring that you share with them a sort of service development plan. So when inspectors come to a provision like mine or others, where you're going to have to look at what we want to show you. We're going to put you in the right direction of speaking to particularly young peoples who have made significant progress. You know, we'll provide case studies of particular, you know, children and young people that have entered our service, where they were at the beginning and where are they at in the middle of that journey. But also we'll be sharing you case studies of, you know, of children that have recently left us and demonstrating that progress. So it is that bit about show and tell. You know, I mentioned earlier about, you know, we hold an annual conversation with Ofsted, and we've, you know, it tends to be about April, but we've delayed it till next year. But, you know, we have that with the lead secure children's home inspector, and it's also joined with us by the HMI policy officer. And some of the themes that I would say is coming out of those annual conversations. One is about, I would say, is about the frequency of inspectors. Secure children's home, no different to any custodial setting, is highly regulated and inspected. And you know, SAN continue to request less inspections for particularly those homes that are being judged good or outstanding, because there is a lot of independent scrutiny, not just from the advocacy service, but also from, as I mentioned earlier, the Regulation 44 independent person that visits. So that's one area that we've actually asked for. The other area that we've asked for is that is around really the EDI agenda. You know, inspectors do not represent the cohort of our children and young people, and often our children, what our children are telling us, how can that inspector relate best to me when he's not from my particular background or experience? And those are the sort of areas that we've been talking to from a sort of SAN perspective. But I think generally what I would say is inspections is about what you make it. Yeah. So inspections is about what you want to show somebody. If you're waiting for inspectors to arrive at your door, that's not a good idea. I think you should be definitely inviting them in, and that old method of show and tell is very much needs to be evident in terms of your delivery and in terms of managing that sort of inspection process. So I'm going to press pause because I'm conscious of time, and I don't want to go over.
Brilliant. Thank you so much, Paul, and to the rest of our speakers.
And I really value all of your contributions today. I know that we've had a really robust conversation in the chat. I'm sorry we weren't able to capture all the questions and make the session more interactive, but I think what we've shown is a real appetite for coming together in this way, and I really am so grateful to all of you.